Hey everybody, it's Dr. Dave, Psychiatry. Thanks for coming to the channel today. Sometimes I try to make videos that are uplifting, educational. Other times they're just inspirational. I feel something that's important. Other times I talk about things that are just frankly important. It's taken me a while to get to the point where I wanted to make this video, partially because I needed to get a little bit better at making videos, and I feel like I'm a little bit more confident now just being in front of a camera. And so today I'm going to talk about something pretty serious, and that's the topic of suicide. You got prompted, really, I talk about this with every new patient, obviously, and I talk about it with my existing patients when things happen. And last week, somebody said something to me that really prompted the video. She said, I'm struggling right now. My medicines are fine, but a family member of mine has been talking about killing herself. And that's super complicated, and I don't know how to handle it. So I basically went through with her how I deal with the topic of what do you do when somebody is talking about killing themselves, which is a very scary thing. But in fact, it's not as complicated as you would believe. So this video is my thoughts and approach to suicide. Obviously, my intent is to help either you, or if you have a loved one, friend, family member who's dealing with the idea of basically would rather be dead than be alive, which is a very common thing in my office, and it's something that I deal with all the time. It's important for me to stress that this is an educational video. I'm not here to tell you what to do. I'm not your treatment doctor. All I'm doing is giving educational material. And the reason I emphasize that today is if this is a topic that's hot for your life right now, the most important thing you can do is ask for help. And as I've said on previous videos, if you or someone that you care about is struggling with the idea of wanting to be dead than be alive, asking for help is the right thing to do. Now, in this video, I'm not talking about other topics which are somewhat controversial, like the idea that in certain societies, if you have terminal illness, you are allowed to kill yourself or have an assisted suicide. I'm not even really sure if that exists exactly anywhere, but I've heard that it's a topic that's occurred more in Europe than the US. But the idea of euthanasia, taking one's own life to not suffer, that's not a new idea. I'm also not talking about combat situations where a person, might throw themselves on a hand grenade to save others. I'm not talking about that. I'm not talking about so-called rational suicide where someone says, well, I believe that my philosophical right to kill myself exists. I actually knew a patient like that once, decades ago, and I think he just really wanted to argue with me more than anything. So I'm really not talking about any of those things. What I'm really talking about is one of the core symptoms of depression, that when people kill themselves, oftentimes, I believe most times actually, it's in the context of some type of brain chemistry problem. So depression, worry, anxiety, the symptoms that are associated with the different brain chemistry problems that I've talked about before: serotonin shortage, norepinephrine shortage, dopamine excess. People that are in the throes of serotonin and norepinephrine shortage, it's very widely recognized that thinking sometimes that you'd rather be dead than be alive is part of that picture. The core symptom questions of when we screen for depression: do you have low interest? Are you sad? Are you not sleeping well? Are you not eating well? Are you feeling hopeless about stuff? Do you sometimes think it'd be better to be dead than be alive? Many, many, many people that have depression say yes to that. So in terms of the medical aspect, which I take care of in my office, and what you may or your friends or family may be dealing with, in the context of depression, thinking about being dead is a very common thing. When I was in medical school, I remember being scared to ask the question. I think, of course, this was back, medical school, 1984. The idea that if you ask the question, have you thought about suicide, that somehow you might plant the idea and that they might go out and do it because you asked the question. Honestly, nothing could be further from the truth. After over 30 years of doing this, I'll tell you, when you ask that question, Oftentimes people are relieved that you're willing to talk about it. So in my office, when I'm screening people for the first time and I'm going through the depression screen, I ask the questions about depressive mood, low interest, can't concentrate, not eating well, not sleeping well, etc. One of the questions is, do you ever feel hopeless? If the answer to that is no, then I move on. If the answer to that is yes, I do feel hopeless, then the next question I ask is, do you ever feel so hopeless that you'd rather just not wake up in the morning, or that you'd rather be dead than alive, or would rather just not wake up, even if you'd never do it? And that's an important part of that second question. So sort of quickly phrased, it's very often, do you ever feel hopeless? Yes. Do you ever feel so hopeless that even if you'd never do it, you'd rather be dead than be alive? If you're not doing that. That's the question. The answer is, well, yes, actually, I do sometimes have that thought. I think about it'd be better to not wake up. It'd be better to not exist. It'd be better that God took me. People say it in various ways. The third question then is, okay, as we sit here right now, do you have any intention of taking your own life? Now, that's the question that has to be asked. Do you have any intention of taking your own life? Or put another way, are you going to do something about that? So it's really been recognized for decades that psychiatrists are no better at predicting the future than anyone else. So the reality, and it's a stark reality, it's a harsh thing to face the first time you think about it, that if I ask about suicide with a patient and they say, nope, I have no intention, they can change their mind that afternoon. People know how to take their own life. People know how to kill themselves. That's not a secret. But all I can do is at the moment ask, as we sit here right now, do you have any intention of taking your own life? And if the answer is no, then we're good to go. Move on. Because I want to make that symptom of hopelessness better. And I've been given the confidence that working with that patient and taking care of them and trying to offer them medicine is the right next step. And so that's how we handle it. And that's how we take care of people. And guess what? That's really the right thing to do. What do you do when you're not the doctor? So in my office, that's okay. Let's say I'm evaluating a teenager, and the teenager's there with the parent. And I'm talking to the teenager, maybe 17, make their own decisions, treating them like an adult, even though they have certain limitations. In a clinical setting like that, we give them a lot of respect and a lot of leeway, and I personally interview them as if they are adult in the presence of their parent. And the question would be, you ever feel hopeless? Yes. Do you ever think, even though we'd never do it, it might be easier to be dead than be alive? Yes. Okay, as we sit here right now, do you have any intention of taking your own life? No. I pause right there, and I tell the parent, who is the loved one, so if you're not the parent, if you're the loved one, and you're dealing with a situation like this, I stop right there and I say, okay, that is the question that you can ask anytime you want. Now, there's an old concept of this thing called the suicide watch, which I don't like, and I'll tell you why I don't like it. Patient might go to the emergency room with a family member. They're evaluated in the emergency room, determined that they do not have to be psychiatrically hospitalized because they don't have any suicidal intent at the time. And then they leave the emergency room with an instruction, well, we'd like you to watch the patient. Well, that's terrible. That puts the family member on the hook for the person's responsibility and their actions, and I don't think that's right. So I don't really believe in that approach, and I've never really used it, and I don't use it today. I don't think that a loved one or friend has to be on suicide watch for someone who's thinking about suicide. What I do believe is that it's fair for a loved one or friend to be able to check in and ask. And the question's pretty simple. It can be that evening, parent, child, okay, the doc said I could ask you this question. I know you're miserable. I know you're thinking about being dead, but we're going to bed now. Do you have any intention of doing anything about that? If the answer is no, then you go to bed. Now, can the patient change their mind when you're asleep? Yes. But have you done your best? Yes. Is that the right thing to do? Yes. All anyone can do is establish intent. And it's fair to ask the question. And most times people say, no, I just feel miserable. And so the parent would say, I'm sorry you feel miserable, but you know what? We got a plan. We're working on it. We're doing something. So see you in the morning. It's fair to check in anytime. And I tell the patient, that 17-year-old, I'll say, look, if your parent asks you, you just got to answer. Now, if you're going to lie, you're going to lie, and we're not going to know. But if you tell the truth, then everybody is able to work together to try to solve the problem. So I think the patient has to tolerate being asked the question, and the people around the patient have to have the confidence that they're not going to cause the idea, and the right thing to do is to ask the question. This is not that different than any other medical situation. You got a person with a bowel obstruction, and they're at home, and they are having to decide if they're going to go back to the emergency room or not. The question is, hey, listen, is this bad enough that we have to take you back to the emergency room right now? If the patient says, yeah, honestly, I think my gut's going to explode, and yeah, we need to go right now. Well, you've asked, and there's action. And in brain chemistry and what is called psychiatric stuff, if you check in with somebody, say, look, do you have any intention of taking your own life tonight? If the answer is no, then I believe you've done your best. That's all I would do. That's all I do with my patients, or if I have situations or friends or family that I've come across. That's how I handle it. And I think that's a right way to handle it. So that level of communication, number one, doesn't cause the idea, and I think in some sense takes the pressure off. As I said earlier, I think there is a little bit of a sense where when people feel very depressed and they have this thought that they'd rather be dead than be alive, and it's a bad place to be psychologically, and it's an uncomfortable and unusual place for human beings to get. But once you're there, when you have someone else who's there to talk about it with you, in some sense it takes some of the pressure off. Takes a little bit of pressure off that valve because you're not alone and someone's there talking about it with you. Now, what happens when patients lie? It's very rare, or at least has been very rare in my experience, but people kill themselves. They do. And we can't stop them. Once they make that decision, they can say straight to your face, nope, I'm fine. Next thing you know, they're dead. It's tragic. People feel sad about it. My principal emotion is I'm actually more annoyed and sometimes angry at it. I had a friend who killed himself decades ago. The circumstances don't matter. How he did it doesn't matter. But my principal emotion about my friend is that he basically just eliminated all possibility of improvement. There's no chance. The game is over. You end the game with that move. It's over. Now, I know some people want to just end the game and have it be over. Here's the problem. You leave a big mess for the people behind you. And someone has to find you. Someone has to clean up. Someone has to manage your affairs. So suicide leaves a terrible wake. And sometimes when I'm talking to somebody about their ideas about being suicide, it's not inhumane at all to remind them of, hey, listen, we all know that you can kill yourself, but if you do, you're going to leave a terrible mess. And I hope you don't really want to do that to your wife or your mom or your kids or your brother or your dad or your friends. And sometimes that harsh reality is helpful. People say to me, you're right. I don't want to leave people with that. So when people lie and they take their own life, what do we do? Well, sometimes I hear on the media, television news or whatever, when some famous person kills himself, people say, so unexpected. How could that have happened? That person was just so well put together, so successful, so great, so joyful, so creative. Well, then why did they kill themselves? What's the mystery? Well, in my opinion, it's typically not a mystery. And without having evaluated these people, I'm not going to take the leap of saying that they had depression. But the truth is, depression kills people, and suicide as a result of depression happens. And so when someone famous dies and we never expected that, well, even if you're not famous, the people around them might not have expected it, because people hide their depression. And they hide their substance abuse, and they hide the misery that they have, and they hide their plans, and they lie to people, and they say, I'm fine, I'm fine, I'm fine, and then they're not fine. And when that happens, the people that are left behind ask the question, why didn't they say something? I think this gets back to the core of the channel. You know, if you found a lump in your breast, would you hide it and hide it and hide it and hide it and not tell anybody and manage a lot by yourself? Or would you say, holy smokes, I got a lump in my breast. I got to go see the doctor. I might have breast cancer. You'd probably say that. If you woke up one morning and your right testicle was the size of a softball, would you be worried about that? Would you say something? Would you hide it and wait and wait and wait and wait and try to avoid the medical reality? Or would you say, holy smokes, this is wrong. Got to see my doctor right now. Doctor's closed. Go in the emergency room. Hey, look at this. This is not right. This scares me. Yeah, that's what you would do. So what do we do with brain chemistry stuff? And what do we do with things that are called mental? This is the core of the channel, guys. This is the core of the channel. Why call it mental? Why not just accept that it's medical? If you're depressed, anxious, worried, having thoughts of being dead, the likelihood is you have a medical problem. And if there's somebody around you that you know is feeling that way and they're thinking about being dead, man, maybe the clock is ticking. Maybe it's time to go to that person and say, look, this is medical. I'm dragging you to the dang doctor. You know, doesn't even have to be a psychiatrist, could be a nurse practitioner. My nurse practitioner that takes care of me, she takes care of depression all day long. You don't have to have a psychiatrist. You just have to have somebody who is willing to answer your need, your brain chemistry, your symptoms. And if it's depressed, low interest, low energy, helpless, can't concentrate, thoughts of being dead, as long as you don't have the intent to take your own life, man, get yourself in a doctor's office. Now, if you have the intent to take your own life, and this is probably what I'll conclude with, what if the answer is yes? What if you're that parent and you've got your 17-year-old kid and you say, it's 10 o'clock at night, so I'm going to bed now. Do you intend to take your own life tonight? If the answer is yes, I think I do. Guess what you do? You call 911. Hey, my son's here. He's told me he intends to kill himself. I need help. This gets back to my first patient from last week. Is it complicated? It's actually not that complicated. If that gets triggered, that's a 911 phone call. You don't have to do anything. You don't have to talk him out of it. You don't have to get in the car and drive him there. You can literally, if you want to, you call 911 and have the ambulance show up. Or call the police. 911, police, get here as fast as you can. And if the person runs out the building to maybe go kill themselves, you just give them the description and have the police track them down. The only thing that society can do for people who are about to take their own life is to try to prevent it. And in large part, that's what psychiatric hospitalization does. Psychiatric hospitals are honestly not comfortable places to feel better, but what they do is they do protect you from taking your own life as best they can, even though some people creatively find ways to kill themselves in psychiatric hospitals. But being involuntarily committed because of police, law enforcement, EMS intervention to a psychiatric hospital, one of the main things it does is prevent you from doing something which some people would call stupid. Some people would say don't. It just prevents you from doing that act, prevents you from harming yourself while you have the intent. Now, hopefully you talk to people, you get the medicine, whatever you need, and that intent goes away. So you get back to the zone of being maybe depressed, anxious, worried, thinking about being dead, but having no intention of being dead. The truth is, in my practice, of all of my depressed patients, all of my patients that have this thing we call depression, that serotonin shortage, norepinephrine shortage, that cluster, that big group of people that we take care of, mood disorders, the vast majority of them have had the thought, I'd rather be dead than be alive. That doesn't trigger psychiatric hospitalization. As I've just taught you, what triggers psychiatric hospitalization is the intent to take your own life. I saw a guy this morning, just wrapping up, I saw a guy this morning, new evaluation, same story, came in, depressed, anxious, worried, mood swings, also past history of treatment, multiple psychiatric hospitalizations. The issue with him, and he'll know who he is, but obviously we don't identify people here on the channel. The issue with him was that he had taken one of his medicines before and overdosed on it. And since that time, none of the doctors that he had worked with would give him that medicine again because he had gulped an entire bottle of it in what would be called a suicide attempt or gesture, depending on the verbiage. But he had no reservation telling me that he ate an entire bottle of his medication, and since that time, doctors wouldn't give it to him. Well, the problem was that medicine helped him. That medicine helped him. So what am I going to do with this guy that says, hey, I know what helps me, but I abuse that medicine against myself? Well, that's where the rubber hits the road, man. I'm sitting across the desk and all I can say is, okay, here's the deal. That medicine helps you. If you use it against yourself, which, by the way, it didn't kill him. It's because the medicines we use today in large part don't kill people. I said, if you use this medicine against yourself, then I'm just going to say right now, that means that if you're going to use my help against you, then I'm going to stop helping you. So you abuse my medicine against you, I'm out. Now, is that fair? Is that what a doctor should say? I don't know. I thought it was pretty honest. I hope it's therapeutic, but that's what I said. And I believe it was the right thing to say, and he responded well to it. So obviously we'll see what happens. But I think what I was trying to say is I'm not going to allow your past behavior or your impulsive behavior to prevent me giving you something that you tell me right now is going to help you. And I would stand by that decision, and I'm hopeful that he'll come back and it will have been the right decision. We'll see. Because this literally happened a couple hours ago. The other thing that I said to him is that if I didn't give you the medicine, if I just said I'm not going to get that to you, well, that would sort of imply that if I don't give you this, then somehow you're not going to know how to kill yourself. Somehow you're not going to know how to step in front of a train, crash your car, jump off a building, whatever. I don't have to list the ways. You know the ways. If you're an adult watching this, you know the ways that people can kill themselves. So again, the idea there is that somehow I might have, planted the idea that he would kill himself by gulping medicines, or if I avoided that, somehow it would magically prevent him from doing something else. Not in the least. People that have the intent to kill themselves, and that's why we have a suicide problem. But I really want to emphasize the fact that it's not an isolated problem, and I don't think that it's fair to construe an increase in suicide in any country or any place as anything other than a medical matter. Really, I think it's very, very important to realize that people that are depressed kill themselves, and the best way to fight that is to get focused on the fact that they're not mental patients, or that we have a society with mental problems or other social factors that lead to suicide. At its core, the truth is this: people that break their leg have pain, people that have a bowel obstruction throw up, and people who have a brain chemistry problem can kill themselves. So when you were visited with that difficult, frightening, intimidating, scary, and complicated appearing problem, I ask you to try to just keep it simple. Ask the question, are you hopeless? Are you so hopeless that sometimes you think it'd be easier to be dead than be alive, even if you'd never do it? And if the answer to those first two is yes, then the third is, okay, as we sit here right now, do you have any intention of taking your own life? If the answer is yes, call 911. If the answer is no, get the help you need. That's how I approach it. That's my advice. Again, a little bit more serious video today, but I hope it's helpful. And I'm glad you came to see me today. I'm Dr. Dave, Psychiatry. We'll see you again soon.